So for those of you not familiar with American Sign Language, I just signed the title of my speech. Get up to date, vaccinate. In the years 1963 to 1965, there was a worldwide epidemic of rubella, or German measles. I know this firsthand because my mom was pregnant at the time. She was exposed to the virus and she passed it on to her unborn child. As a result, my brother was one of 20,000 babies born in the U.S. with severe birth defects. Another 11,000 babies died, according to the Centers for Disease Control and Prevention. My brother was born completely deaf, partially blind, and had to undergo an intensive open heart surgery as a tiny baby. The rubella vaccine did not emerge until several years later, so my mom didn't have an opportunity to protect her child, but we have better options today. So I hope that you'll learn something from my presentation today and not be dissuaded to make sure that you keep current on your vaccinations for yourself and for your family. My three main points today: talking about the benefits of becoming immunized, risks and concerns related to vaccination, and vaccination recommendations. So one of the benefits of becoming immunized is that it is the most effective tool in the prevention of infectious diseases. Because of the success of all of those vaccines over the last few decades, many of us as Americans, we just don't have firsthand knowledge of those kind of epidemics that swept across the world: polio, diphtheria, TB, and so we need to be aware of those and be recognizing how important it is to be vaccinated. The vaccine actually helps your body's immune system prepare for any future attacks or exposures that you might not even be aware of until it's too late. The other benefit of being immunized is that it reduces or even eliminates any health risks or possible death due to infectious diseases. According to the Center of Disease Control and Prevention, the majority of childhood vaccinations provide immunity to 90 to 100% of those children that receive those vaccinations, which is pretty amazing. A decade-long vaccine program between 1966 and 1977 eradicated the smallpox vaccine worldwide, so we know that they work. And another benefit of being immunized is that vaccinations are often required for school or work. So some of you may have discovered this already if you're maybe going into a clinical field as a phlebotomist or a CNA or a nurse. You're going to require vaccinations probably just even for your school program, and then when you get out into the workforce or your clinical rotations. And I work in a healthcare facility. I don't take care of patients. I'm a paper pusher, but I also have immunizations that I'm required to complete and be tested for as well. So risks and concerns, and I know there's a lot of concern out there now about vaccine safety. So I would hope to dispel some of those. So according to the Institute of Medicine's studies they've been doing since the 1970s, rather than exposing our children to any unsafe vaccines, the opposite is actually true, that when we follow the recommended immunization schedules for our children, that they have a greatly reduced chance of receiving any vaccine preventable disease. They really do work. Their reviews have also not found any data that suggests that vaccines are related to asthma, seizures, attention deficit disorder, autism, behavioral disorders, anything such as that. So they are very safe, even though you may have heard differently. For example, a lot of people feel that the MMR vaccine, which is the measles, mumps, and rubella vaccine, is related to autism. But what is most likely happening is that the child is receiving the immunization around the same age as they are being diagnosed with autism. So the parent then correlates that vaccination to the diagnosis. So that's what's happening a lot of the times. And technological advances have really increased the safety about vaccines, but people still feel that, you know, they have that live virus in them or they're going to make me sick, and that's not necessarily true. The antigens, which is the virus and the bacteria, are actually dead or inactivated, so they can't cause that actual virus. But a lot of people feel that with the influenza vaccine, for example, and that's not true. The influenza vaccine is actually dead. But people might get a flu shot and they get the flu, but a couple of things might be happening. They might have had a different strain that they were exposed to that was not in the vaccine. That does happen. They have to anticipate a year ahead of time what they're going to put in the influenza vaccine. And the other thing that might be happening is that you got the vaccine maybe a week or two ago, and then you were exposed to influenza, and you did not have time, your body did not have time to build up those antibodies to protect you. The other concerns around vaccinations is A, availability, and B, affordability, because granted they are expensive. So on the Centers for Disease Control website, you can find a really cool tool that you see here. I've done a Snagit picture of it, and it's in a vaccine finder, and so you can just type in your zip code and you can look for locations that might be federally funded health centers that can provide vaccines for you. Depending on your income, might be little to no cost for you. So when I typed in my zip code, I got all of the Valley View health centers around our local area and the CMAR clinic up in Olympia. So really cool tool. And yes, vaccinations are expensive, but if you are looking at the bigger picture of protecting yourself and your family, as well as the $10 billion a year that are spent on direct medical costs and lost work-related costs, that, you know, just tells me how can we not spend the money and protect ourselves. So influenza, again, for example, uncomplicated influenza illness can cause 15 days worth of suffering. So vaccination recommendations. There's a great website, vaccines.gov, so a really easy one to remember, that has all these schedules, and you can see that one of the schedules that I put up here on the screen is the adult schedule. So very easy to read. You can see the age groups, and then you can actually click on the hyperlinks for each of the vaccinations and read more information about it. So that goes from infant to college age, teen years, college years, adults, and seniors. So they have a great tool there. And we hope that, you know, when we reduce epidemics and breakouts, that's great, but we shouldn't become complacent. So just because we haven't heard about TB for a long time or smallpox, it still is in our community, and we do see patients at our hospital with TB. So it's around, and we need to make sure we stay on top of it. And a good way to do that is to keep up to date with our local and worldwide outbreak warnings. For example, pertussis or whooping cough. I'm sure most of you are aware that in 2012, Washington State had an epidemic of pertussis, and we had a lot of sick little kids, as you can see from the graph. In 2011, less than 1,000 cases, and it was less than that in 2010, so it just slowly increased. Last year, almost 5,000 cases reported of whooping cough. So we've talked about the benefits of becoming immunized, and that's not all of them, but that's just a couple of them that I went over. Some risks and concerns related to them, and some recommendations on where you can find more information to get help. So my question to you is, will you make a promise and a commitment to yourself and to your family to learn about vaccinations, keep your eyes and ears open to what's going on locally and worldwide, and hopefully prevent any serious lifelong disabilities or even death for your family and your loved ones? So will you get up to date and vaccinate? Thank you for listening.